flag of the United States of America, and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Good afternoon, everyone. Thanks for being here. We'll start with meeting minutes from January 10th, 2022. We have a motion.
I'll make a motion to approve the minutes.
I'll second that.
Motion made and seconded. Any discussion? If not, all those in favor say aye.
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 Opposed? Next, review and approval of the agenda. Anyone have anything to change, remove, or add from the agenda? If not, is there a motion?
Mr. Chair, I'll make a motion to approve today's agenda.
Okay,
I'll second it.
motion made and seconded. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed? Consent agenda. Anyone have anything to add or modify in the consent agenda?
Mr. Chair,
Commissioner Wetter?
I'd like to pull A for further information.
Right, letter A. Anyone else? Commissioner Delighten?
That's what I was gonna pull.
Okay,
I'll make a motion to approve it.
okay, approved.
Agenda with a pull.
And I'll second.
Okay, any further discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion carries. All right. Commissioner Wetter on letter A.
Well, I guess I am not on any of the IT committees or anything, but I guess I'd like to have more information on what, I don't know, IV techs? Is that how you put it now? Avtex? Explanation on what that is, what it does, why it costs so much, and you gotta have a subscription for a while, too?
So, yep, so I just would, Commissioners, hello, good afternoon. I'm sitting in for Jamie today. And to speak to Avtex, this is actually our renewal. This is our contact center, the new phone system that we got last year. So this is the renewal for that contract. And if you'll recall, the goals of that program was to utilize software so that we could utilize using the same phone number, whether they might be in the office setting or remotely, so that our staff are able to answer calls coming into one phone line, because this was seen as a need definitely when we all went home for COVID. We saw, holy cow, we're all getting calls to our office phones and we're not there. So this is a system where we're able to really maximize our capacity and efficiency for our clients. And our goal was really to enhance the customer experience so that they're having a seamless call and not getting lost in our call tree and all of those different things. So we're pretty fully invested. We're already utilizing it and looking at the data it's providing us and trying to look at where we can continue to enhance services. A big area where we saw a lot of growth or a lot of expansion in our service delivery was we got back to being able to have all our financial workers on their queues for their calls. So in financial services, a lot of the cases are what's called case banked. So a group of people manage the same call line. So a caller calls in, if someone's not available, it rolls to the next person, and so on and so forth. And now those folks are able to man those lines, whether they're in the office or home or mobile, and it just gives a lot more efficiency to our service. So I hope that gives a little more explanation.
The over $500,000 one, is that adding on? Is that some more adding on to what you have already, or?
I think it's continuation of, but I'll let Kate jump into that. Yep, you have at it.
All right. So we have two contracts on there. One is for Genesis, the cloud software itself, and then we have the Avtex support, which they support the software. The company Genesis Cloud does not do the support. So that's why there's two agreements. And how it works is the licensed agents. We have licensed agents and some that are just business users. So that's why you see the subscription fee for some and not for all. So out of 250 staff, only 90 have the agent license, which is the fee that you see. So they're part of like the call center itself and are part of a queue. So does that answer your question?
Sort of.
I got a question.
Okay.
So that $500,000, is that every year then?
Nope, so this is a 2-year agreement. So we paid for year one, so this is for the next 2 years.
Okay.
Oh, okay.
Yeah, so right now, there was $11,000 increase coming up in 2 weeks, or on the 16th, so actually this week, but we got in, this contract will get in before the increase for the support. So,
And if I remember correctly, one of the options with this program is that we can do reports too.
yeah.
Correct,
So
yep.
if we don't think Jill is doing her job, we can pull up her reports and find out how many phone calls she's answered and how many she's let go to voicemail,
Oh,
that
okay.
sort of stuff.
Okay.
I have a question, is it more likely now that you would get a real person if folks call into Health and Human Services with this system and less likely you'll get a recording or?
That's the
browser?
intention.
That's good. It's always good, I think, at this county level, that people want to talk to a real person. They lose interest quick, I think, if you start transferring them around. Is there a bid process for this? Is there a lot of vendors that provide this kind of service, or how did you settle on this one?
2 years ago, I don't know who was all part of that, do you guys know? Jim's not here and I'm just kind of subbing in for this.
Initially, this whole thing came about, actually before you joined. It was 8 years ago when commissioners were getting calls about my area not picking up the phones. And the question was, where are you guys? Why are you not picking up these phones? What is going on? We're like, we don't picking up the phone. They're like, get something to figure this out. And so we did. Current phone system, but it really wasn't a very good. You know, when they came in, they did their little sales pitch, saying, "Hey, this is what we have." That wasn't really what they delivered. And so when we moved to this new phone system, or decided on the one, so this one really has the support behind it, and they're bringing the support, and so it was quite the build process, and it works amazing now. So if you call into Health and Human Services, specifically financial services, or getting somebody on the line, unless there's something weird like everybody's in a meeting, which it just, everybody is picking up the phone. And we have reports that show our service level and things like that. I'll give you a great example. We're inundated right now with calls, more than we have ever had, because financial services is at a busy point. So our child support area volunteered to take calls. So they signed in to those queues. A lot of them used to be financial workers. You know, child support, they're like, we can answer those calls. We have access to those systems for you. We'll just hop on the phones for you. So they're able to log in there, get calls, give people the services that right then and there, rather than mail and just, which is just, it's just been a godsend. So if you call financial services, you are likely getting somebody on, probably the first time around. And if not, firm handoff to, sorry, I can't help you with that. Let me get Kim on the line, she can help you. And then they say, Kim, are you there? Yep, I'm here, this is what they want, okay. And then it's like, who's on the line? She's gonna be able to answer it. It's much better system.
And the other part of that is there other companies out there that you can check prices, or?
So when we would have done the bidding at the time, I think that there was, I'm
At
guessing
least-
you guys looked at least 3
I'd say at
vendors.
least 3.
I wasn't a part of that, but that's,
Yeah.
yeah, so, which that is part of the typical process we go through with a large contract like this.
Okay.
3 vendors.
That was 8 years ago, or you did that this time too?
Nope, that would be
There
year
you go.
1. So
Oh.
we just implemented this in March of 2021, so we would have did that right before that. So this is just the continuation on. This is, we already signed the master agreement, this is just the service level for the next few years.
Good.
So,
And we did bid process and had demos and had many, many meetings weighing the pros and cons of this service could provide these check boxes, this can do the other check boxes, and really weighing out cost and efficiency and what we actually needed to make it functional, as Kim was saying, to actually work for our needs, and this is where we landed, and so far have been quite happy with it.
Thanks for the explanation and coming prepared to give us a little bit for $500,000.
yes, thank you.
Yeah,
Anything
thank
else?
you.
For a motion?
I'll make a motion to approve that.
Okay. Motion
Second.
made, seconded. Further discussion? Those in favor say aye.
Aye.
Opposed? Motion carries. All right, we're done with the consent.
No, you got the new hires. We gotta, roast the new hires.
All right.
It's not fair if we don't.
Okay, new hires. So as the chair, or whatever you want to call me now, I'm going to say, new folks, welcome to Wright County. Do you have anything you want to share with the board? Because if you don't, I'm not going to be the one to initiate to talk about habits and hobbies and all these things. If others want to do that, but I'll set the tone from this spot anyway, that I don't need to put you through that.
Would you like me to just at least identify and introduce?
Yes.
Yes,
Oh,
we'll do
yeah.
that,
Definitely.
but then if they want to say anything extra, it's up to them.
Jennifer Kelly, I'll have you stand. Jennifer is the case aide in our Child Protection 1 team, and Julie Benboom, who's next to her, is her supervisor.
Welcome.
Thank you.
So where are you from?
I grew up in the Iron Range,
Ah,
And where do you live now?
here in Buffalo.
Ah.
good.
Well, you live in the Wright County and you work for the Wright County.
Yeah.
Life doesn't get any better.
Thank you.
Welcome.
Morgan Anderson. Morgan is a social worker in Leanne Mills.
Welcome, Morgan.
Yes, so what do you really think of Luann?
Well, I've worked with her twice now because I worked for Thomas Allen Contracting for Wright County
Oh,
before directly to Wright County, so,
Oh.
okay, we stole you, yes.
yes, you did.
So where'd you grow up and where do you live?
I grew up in northwest Minnesota, about 30 miles from Canada, 30 miles,
Oh,
5 hours from
So you did a lot of ice fishing up there along the,
ice fishing, snowmobiling, yeah.
so where do you live now?
In between Becker and Big Lake.
I'm glad you're not commuting from up there.
I was gonna ask something.
Only about a
but I
5-hour
don't-
commute.
I probably better not, it'll get political. What do you think of what the Canadian truckers are doing?
Oh, it's interesting. My husband was a trucker, so I think it's very interesting. Yeah. Yep.
Let that go.
And then we have Christy Poole. She's an accounting technician and fiscal team under Keith.
Hello, Christy. Welcome.
Where are you from?
I'm originally from Becker, but now I live in Big Lake.
a big move. Welcome.
Well, hopefully you'll move to the Wright County someday.
Yeah, thanks all for being here.
Next is Employee of the Month, February and March.
Yes. All right, first we have Beth Hammer, who is actually, I think, online. Beth, are you with us in Teams?
Yes, I'm online.
Okay, then maybe I'll read from here if that's all right.
Okay.
We can't see you. You're in the dark.
I am kind of dark, aren't I?
Are you
Sorry about
trying to hide your face? Are you on
Witness
protection?
Maybe.
All right, so Beth is our February 22 Employee of the Month. And Beth, I'll go ahead and read her nominators document of what they wrote in for their nomination. Beth is an adult protection social worker in our assessment services team and has been with Wright County for 15 years. She is a fierce advocate in person-centered planning and focuses on client dignity and respect for self-determination. She enjoys investigating self-neglect allegations and assists with Wright County constituents as being as independent as possible while remaining safe in their communities in which they live. Beth's nominator states, I recently had the opportunity to work alongside Beth on a tricky case with mutual clients. The clients were able to qualify for elderly waiver, and with Beth's assistance and outstanding customer service, were able to secure a safe housing option in an assisted living facility. Beth also assisted these clients with their move as they had no informal supports in the area. Beth ensured that these clients received services and supports they needed to find stable and safe housing. These clients would have had a poor outcome and have struggled to get the services needed without Beth. Thank you, Beth, for your dedication and your commitment to our clients, and congratulations on being our Health and Human Services February Employee of the Month. And Beth, I will get you your certificate when I get back to the office. I'll put it on your desk.
Congratulations, Beth.
Congratulations.
Thank you. Thank you very much.
Thanks for the good work.
Yes.
All right, and then we have Jill Van Busicum is our March Employee of the Month, and I'm going to embarrass you.
The hot seat.
You get extra
Next time you'll
credit.
join her team. All right, so I'll read her nomination. Our March Employee of the Month is Jill Van Busicum. Jill started as a general intake social work intern in 2003 before joining the Children's Mental Health team in 2004 as a case manager. Her nominator states, Jill has always been a very enthusiastic children's mental health social worker. She goes above and beyond not only for her clients, but also her team. Jill comes up with creative solutions to barriers, and her contribution to the team is incredible. Jill collaborates well with the schools, probation, her community agencies, and providers. She brings her personal passion for others, and it shows in the work she does. Jill's desire to help families in need, along with her ability to raise money for charitable causes, resulted in her creating a nonprofit organization that was able to help numerous Wright County families this year and in years past. Jill is truly an asset to Wright County Health and Human Services. Thank you, Jill, for your excellent service, and congratulations on being the March Employee of the Month.
Thank you very much, Jill.
You get extra credit
Congratulations.
because you came in today.
No, they buy you lunch, don't they? Or your supervisor does?
Yes, absolutely.
That's what I thought.
And we're in talks with conversations with admin to find a parking spot at the new building.
Yeah,
For our
we have
employees.
talked about a couple of different spots, either close to the building
Or
or
really
really
far
far away. But they
For
will have
exercise.
they will have a reserved spot, you're guaranteed.
All right, next is regular agenda. Get started with proclamation, March as Social Work Month. Jill and Michelle.
Yes, and typically I have gotten the coin toss, and Michelle has read these for many, many years. And so I told her I would take my turn this year.
To music?
Yeah, probably not. But without further ado, are you all right if I go ahead and read?
Yeah.
Sure.
Whereas the social work profession for decades has been dedicated to improving human well-being and enhancing the basic needs of all people, especially the most vulnerable among us, particularly during the global pandemic. Whereas this year's Social Work Month's theme is "The Time is Right for Social Work," embodies how our social workers rose to meet the most pressing challenge of all of our lifetimes, the COVID-19 pandemic, even as our nation continues to grapple with systematic racism, economic inequality, global warming, and other crises. Whereas social workers are the largest group of mental health care providers in the United States and work daily to help people, whether in person or remotely, overcome substance use disorders and mental illness such as depression and anxiety. Whereas social workers have always helped people overcome issues such as death and grief and helped people and their communities recover from increasing natural disasters such as fires, hurricanes, and earthquakes brought on by climate change. Whereas social workers have helped this nation live up to its value by successfully advocating for equal rights to all, including Black, Indigenous, people of color, those who are LGBTQA, religious groups, and others. Whereas the social work profession is one of the fastest growing careers in the United States, with more than 715,000 social workers today and nearly 800,000 professionals expected to be employed as social workers by 2028. Whereas social workers have continued to push for changes that have made our society a better place to live, including livable wage, improved workplace safety, social safety net programs that help ameliorate poverty, hunger, and homelessness. Whereas social workers possess the necessary expertise to assist our nation in some of its most demanding concerns, including their health and well-being, not only during the pandemic, but at all times, ensuring equal rights, improved health care and mental health care for all, and immigration reform. Whereas social workers work with all facets of our society to meet people no matter their circumstances and empower them to live to their fullest potential. Now, therefore, in recognition of the numerous contributions made by America's social workers, the Wright County Health and Human Services Board proclaims the month of March 2022 as National Social Work Month and call upon all citizens of Wright County to join the National Association of Social Workers and Wright County Health and Human Services in celebration and support of the social work profession. And Jamie said she will sign this and get a copy to you when she is back.
Thank you.
Thank you.
All right.
Although,
What? I didn't
Need
get a rating?
resolution, or
yeah,
It's a proclamation, it's not a resolution, but it's,
just a motion?
Oh, do you need a resolution?
normally we do.
oh, yeah.
But I'll
it
make
did-
a motion to
Yeah.
approve the resolution for this.
Okay,
Okay.
motion made,
I'll second that.
seconded. Further discussion? If not, all those in favor say aye.
Roll call.
Oh, roll call.
Call vote.
Catch marks, aye.
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 Motion, resolution carries. Thank you.
Thank you.
Number 2 is a presentation, public health emergency response. Sarah and Jacob.
I'm really just gonna turn this over to Jacob. And that's why Dan is here. Invited our sheriff's office partners, emergency management, just so that they knew we were doing this presentation. But he put together most of the data.
Yep, so, I'm sharing, I'm assuming, awesome. So yeah, thank you to all of our partners that helped us. As mentioned, Leander's here, we have some people joining virtually. Also, I'll get into how they helped us throughout the presentation, but kind of go through what Wright County Public Health did in response to COVID-19, really looking at vaccinations. So, to kind of put us in the mind frame of when this all first started, because it's been quite a while, some dates from the beginning of it. The first reported COVID-19 case in Minnesota was 3/6/2020. The first case reported in Wright County was 3/13/2020. Wright County Public Health and Wright County Emergency Management opened up our Joint Operations Center on 3/12/2020. Many of you probably remember this time, but on 3/18/2020, the schools closed. And then 3/25/2020, that Minnesota stay-at-home order went into effect. The first death from COVID-19 reported in Wright County was on 4/9/2020, and the mask mandate statewide went into effect 7/25/2020. So that's just a little bit of a look back on what happened, especially in the beginning of it. As we continued through the response, a lot of it was in partnership with emergency management, but as we approached vaccinations, it really kind of shifted to our role as public health to make sure we get vaccinations in arms, with emergency management helping. So to go through some statistics, communications, so we did a lot of communications throughout the whole response. So number of press releases that went out was 31 total. The number of social media posts that went out were 311 total. And the Wright County dashboard, the COVID-19 dashboard, had 103,827 total views. So that was a huge partnership between us and the GIS team to get that dashboard up and keep it consistently updated, even though the data would change fairly often, and how it was reported would affect the dashboard from time to time. The couple things I would mention that we couldn't really capture from this was the total number of calls that came in throughout COVID-19, the total number of impacts on our social media we don't have as well documented, and just the amount of in-person communication and conversation that happened throughout our clinics and through different presentations that we did during this time. Next, case investigation and contact tracing. Wright County Public Health took part in case investigation and contact tracing early on in the response. Later, the state did take it over for the whole state, but we partnered with them and with some of our surrounding counties to do it for a little over 3 months. And in that time, we had 9 total staff dedicated to it and trained to it. In those 3 months, 743 interviews were completed, and all those interviews were conducted 7 days a week for those 17 weeks, including holidays. So we had staff that were manning those systems and making those phone calls even on the weekends and holidays to make sure that people were getting information in a timely fashion. At this time in the pandemic, it was giving them guidance on quarantining, giving them guidance on how to inform other people. Testing was still pretty limited at this time, but it was letting them know what their options might be. The other part of this that I would add is public health in partnership with the rest of human services did a lot of essential services. Thank you. Essential services, so if these individuals indicated that they needed food, needed any service, we would connect them with it or get them food to make sure they had it and didn't have to go out into the community. Vaccinations. So this is really what we in public health focused on. So over the whole vaccination series, we did 17,345. That was done in a total of 76 clinics, with a total number of hours spent at clinic, including setup and teardown, being 478.5 hours. The first vaccination given by Wright County Public Health was on 12/30/2020. And the largest day we had was 1,200 individuals, and that was at the STMA Dome, largely to meet of the teachers at that time who were in those early priority groups to make sure they got vaccinated as quickly as possible. Questions as I go through this?
Good.
So a little bit of history, look back on how our vaccination efforts went. You'll see Buffalo Centennial Fire Hall. This was the first place we did one of our mass drive-through clinics. So we reached out to our fire departments and see who could help us with these and who could really help us do a drive-through clinic. That was one of our unique things about our responses. We really did a lot of our vaccines through those drive-through clinics, where a lot of other organizations set up in buildings and may have had walk-through clinics. So Buffalo Centennial Fire Hall let us use their space to do it. Not the best picture, but our early vaccination efforts at Buffalo Centennial Fire really was pretty small compared to what we ended up doing. We could fit 3 cars in one bay, and we'd vaccinate those 3 individuals, have them pull around on the side of the building and do their observation out there. So compared to what we advanced to, it was pretty small in nature, but at this time when the vaccines were rolling out, we really weren't getting a ton of vaccine. So one of the things that we ran into, if you all remember, is vaccine supply was pretty limited at the time. So these first clinics, they were focused on EMS, fire, law enforcement, and one of the big benefits of being in the fire hall was a lot of individuals knew where they were at. So we could get them in and get them out and get them in and get them out quick.
And that was just using one bay?
That was using one bay, yep, it'd be 3 cars. So pretty tight squeeze, and it wasn't the best weather, so we'd be outside in the cold, but made it work. We learned a lot very quickly in how to change things as we went. What we ended up advancing to towards the end of our response is we did drive-through clinics at the highway department. What you'll see here is we would have 2 rows of 5 cars pulled in, so 10 cars total. We would vaccinate them, and we'd have them pull straight forward in that bay, and we could fit 10 cars front to end on one side. So 20 cars total, 10 getting vaccinated and 10 waiting for observation. Due to observation times, we'd have to push some of them outside. It was a 15-minute observation, and it took us under 10 minutes to give a shot. So due to time frame, we'd also have 10 individuals waiting outside. At this point in the response, we had more vaccine and were able to get more people in, so that's why this space was such a great one to use. And as mentioned, it was at the highway department, and huge thanks to the highway department for allowing us to have this space and utilize this space for vaccinations. It really made things go very smoothly, very quickly, and was really good when it got cold outside. Instead of having to open and close the door a ton, we could keep it closed and keep people moving in and out. This is a photo of an example of what our vaccination setup would look like. So we would pre-draw some of the vaccines, have them set on a centralized table that nurses could then come and grab them, administer them, fill out the paperwork. Off to the side here, you would have had our date entry, and off to the back, in the back of the photo, I actually believe Leander. Quite see him. Leander in the Sheriff's Department was great at helping with our clinics, providing security and being present at them for anything from someone's car not starting to just being there to check up on us and make sure we're safe. So again, huge thank you to you and your team for what you did. Our largest day, as mentioned, was at the STMA Dome. So for those of you that don't know, they cover their football field in a seasonal dome in the winter and allow it to be a public space to be used. We had worked out an agreement with them that we could use the space from our vaccination clinics. In total, we had 3 there. So what individuals would do is they would park and walk in. This was a walk-through clinic, and we used about half of the field to vaccinate and observe individuals that be coming through. In total on these days, we'd have 20 tables set up for vaccinators, so we would really move people through, and it was really a whole department-wide effort to make sure that we got people through in a timely fashion and in a safe fashion. Here's a photo of that day where we did as many as 1,200. As you can see, it was a lot of people to make it happen. Huge thanks to everyone that helped with that day, but we got a lot of people through and a lot of happy people to get their vaccines in a timely fashion. So a couple challenges that we ran into that I wanted to call out. The first one that we ran into was a snowstorm hit Texas and kind of messed everything up. Due to that snowstorm in Texas that knocked out power, it also knocked out our shipments of vaccine. So that caused us to have to cancel clinics and caused us to not know when we were getting our next shipment of vaccine after we had people already scheduled. It was a little bit of a scramble to make sure we got people canceled and rescheduled in a timely fashion, and wondering if we were going to get double the vaccine the next week or if we were going to get the previous vaccine we were owed or not. The next big one was priority groups and deadlines. Priority groups were an interesting thing to handle. The priority groups often changed, and it created some tough conversations for a lot of our staff to do during clinics. For example, one of them was 65 and older. We had many communication staff and call staff who had to inform people that even though they're 64, they're not quite there, and that's a really hard thing to do when people wanted the vaccine. The other thing I would add to that is the deadline. So we had a reporting deadline of 24 hours with all vaccines given. So each time we gave our shot, we had to make sure all of our records went up to the immunization record system in Minnesota and make sure that they were all present there, and we'd get called up by the state if we missed any. I think thankfully we never missed any, so we would make sure that system was updated and people could access their immunization records in a timely fashion. The other big thing was no waste. Happy to report we did not waste vaccine until very far into the response, until well after MDH said we could. We were allowed to waste some. So they very much stressed in the beginning that no waste, no waste, no waste, and we very much walked to that mantra and made sure we stuck to that mantra. The thing that complicates with that is if you have no-shows, if you have no-shows, then you have to figure out how to fill that spot and make sure we get vaccines in arms. You can't really pre-book appointments because you don't know how many vaccines you're going to get next week. A lot went into making sure that we had no waste, and it was a huge effort by our immunization team to make sure that we had enough vaccine, one, had enough appointments, two, and made sure if we had people call that couldn't make it or found it elsewhere that we could fill those spots in a timely fashion. Storage and handling was another challenge. As many of you know, the Pfizer vaccine is ultra cold storage. The Moderna vaccine is not. Early on in the response, there was conversations of how do we manage this, how do we transport, how do we transfer to other agencies if we have to, how do we get from other agencies if we have to. A lot went into the storage and handling and making sure that we were doing it properly and doing it efficiently. With the most recent vaccine efforts with 5 to 11-year-olds, the Pfizer vaccines need to be diluted, so there's that extra work that goes into it whenever you're doing a clinic. Supply shortages, one thing we definitely ran into was supply shortages on needles, masks, vaccine in general, and really trying to navigate that. As many of you may know, the state stock of supplies wasn't as well supplied as we originally thought it would be, and resulted in us purchasing a lot of our own supplies and having to manage and try and make sure we had enough of those supplies. Scheduling. I don't know that any of us really had the idea of doing 1,200 people clinics in mind when we were purchasing or developing our scheduling systems. So huge shout out to everyone that made our scheduling system work and really kind of massaged it to be what it was and to do what we needed to, even though it wasn't really ever built to handle that volume of clinics or volume of appointments coming through. 2-dose series. So with Moderna, the vaccine that we primarily did is a 2-dose series. So always trying to make sure that we would do a first dose clinic and a second dose clinic. With that, and not trying to waste if individuals did not come to that second dose clinic, trying to work with them to make sure they could get their second dose, but also trying to fill that spot at the clinic because again, we couldn't waste and we had to report that information out in a timely fashion. J&J pause, so there was a time in the United States during the response that J&J went on a pause to be reevaluated. That led to us not only pushing out a lot of information, but fielding a lot of information from individuals that were calling our office wondering what had happened, why it had happened, and it just happened to be that the pause went into effect shortly after we did a clinic with where we gave out a lot of J&J. So we had a lot of individuals who had our contact information, wanted answers, and had to work through it with them and understand them, help them understand what was going on. And then vaccine misinformation, something we continue to battle today, but something that we definitely ran into with our communications and trying to make sure our clinics were getting full. and something, yeah, we continue to battle today. So, county partnerships. I think this is kind of the meat of the presentation. I had mentioned Wright County Sheriff's Office. Leander and his team and others at the Sheriff's Office made sure we had support at our clinics. We had support from them to make sure we were safe. If anything was happening in the community that we needed to be aware of prior to going to a clinic, we were informed of it just so we had a full scope of what was going on. Along with that, I would say the Sheriff's Office, when we did have reactions to the vaccine that we needed to contact dispatch for, they were very responsive and got people there in as quickly as they could, and were helpful with that. Wright County Highway Department, so as mentioned, our largest drive-through clinics were done there. It was a huge partnership, and it was awesome to use that space in something I don't think it would have ever been imagined it would be used for. All the people we worked with there were great. All of them continued to be helpful as things changed and as we had to move things. And really, without them, I don't know what our response would have looked like. Huge kudos to them and them to allow us to use that space. Wright County Communications. So John Haller is very helpful and very active in pushing out any information we have, which includes promoting the dashboard and making sure that that's updated in a timely fashion and that people can have access to data that they need. Wright County GIS team, I believe they're on the call, but huge shout out to Alec and Mike on that. They built the dashboard for us, and they built it in a way that met both HIPAA compliance and made sure that we could run it on our own. So the data that we use is something that's not public data, and what they had to do is build us basically a system that could run a report and populate that dashboard without ever actually seeing the data. Wright County Emergency Management, as mentioned, they helped us very much in the beginning of the response and continue to help us throughout the response, both with supplies, finding locations, even just advocating for us in ways that they could. Recently, we worked with them to distribute quite a few masks out in the community, 25,000 masks out to different community organizations so they could have them. Health and Human Services Physical Department. I believe there is a slide in here that mentions it, but huge shout out to you guys for making sure we recouped what we could, followed up when we had to, and made sure that we could get all out of this that we could. Our front desk staff at our office, a lot of times with these clinics, we'd have to assemble packets of information beforehand that'd be handed to individuals. Our front desk staff did that about every time we asked them to, and also fielded a lot of questions that I don't think they ever would have thought they would have got. Our Human Services Technology team really helped with that scheduling system and pushing out information where it would be. Wright County Facilities Maintenance and Custodial staff made sure we had clean facilities when we were operating, and made sure we had what we need in those spaces. Wright County Social Service staff, volunteering in clinics and making sure we had what we needed and had the bodies that we need at those clinics. And then Wright County Risk Management, Tim Dahl was very helpful in all these clinics in making sure we had the stuff we need and making sure to review our processes so that they're safe and efficient and effective. A couple community partners. We did a couple school-based clinics, one at STMA, so thank you to them for letting us use the dome and allow us to vaccinate teachers very quickly. Delano School District, we partnered with them to do youth vaccinations at 5 to 11. Same with Monticello School District. And then Buffalo Hanover School District. We utilized that space in partnership with one of our clinics to vaccinate youth as well. Shout out again to our hospitals and clinics. They continue to be stressed at this time, but through our partnership with them, we were able to meet the needs of our communities. Fire departments across Wright County, as mentioned, our first mass drive-through clinic was at a fire department. They continue to be helpful where they could and continue to be receptive to feedback when we gave them any. Wright County Community Action, they recently helped us distribute test kits and masks, and they continue to be a great partner. And then faith communities across Wright County. One thing we did early on with faith communities was try to get information out there early and often about vaccines and about vaccination efforts so that they could share them with their congregations and so that they could be good stewards of the vaccines. So what does this mean for hours? The time billed to public health around COVID, the total amount of COVID hours from 1/1/2020 to 12/31/20 2021 was 38,301 total hours. That equates to about 32% of all public health time going to COVID. The thing that I would say about this is we had a lot of staff that continued their normal jobs while this was going on. We had several staff who were full-time into the COVID response, but a lot of our family home visiting nurses, for example, and a lot of staff around public health continued to do the things that they had to do. Our overtime hours, we had 1,354. Our ICS briefings, which is our incident command structure briefings, which is where we brought our whole team together. We had a total scheduled amount of 546 for the first portion of our response, and then from 7/1/2021 to the end of the year, we had 20.5 hours. In the operations and plannings meetings, we had 71 total hours in those. That was really around planning and making sure we got information out about clinics and were prepared for clinics. And then financial information, this was shared by Christine, but the total salary and fringe coded to various COVID grants and FEP starting with March 2020 is $1,980,000. And the total immunization fees of 2021 and 2022 is $324,500. This includes regular influenza vaccines, but we cannot easily pull this apart in IFS. It's relatively $120,000. That's all I have. Again, thank you to all the partners that are on the call or are here in person for making it possible to get as many vaccines out as we did. Questions?
Nice, complete report. Thank you.
Jacob, thanks for coming in. That was pretty complete. A couple questions. If this happened again today, is there a partner out there that you didn't have that you wish you'd had, or another facility that you wished you had access to that you didn't?
I always think there's room for greater partnerships with different organizations. I don't know if you have a partner specifically in mind, Sarah.
I think if we could be more geographically diverse in some of our locations for our clinics, that would have been better. We tended to divide the county in thirds, north to south, but weren't able to do as much east to west. We were able to recently partner with Hennepin County to do something in Hanover, so that was nice to offer a different location, but that's the first time we were able to do something like that.
Yeah.
I think what Jacob and ours issue right now is we'd like to move forward on a testing contract. And hindsight being what it is, if I'd known we were going to recoup so much revenue for billing and that we would have room within our grant, I would have stopped asking the state several months ago to provide that resource and would have looked at providing it ourselves. But we are running into real estate issues with that. There is not a location that we can find at this time.
So you need a spot to be able for people to come in and do testing?
Yes.
I will say, I think the one unique thing about this pandemic, especially in thinking about partners, it affected such a wide amount of partners. So, for example, our schools were strapped a lot of the time, and usually they are the ones in our plans where we'll do walkthrough clinics. So we'll set up in their gymnasiums and do walkthrough clinics there and be able to push some higher numbers through in a short amount of time. Because of this way, the way the pandemic really affected them, it wasn't as feasible to manage all those moving parts and make sure that would happen. So.
I think going forward too, regardless of whether or not we stand up at testing, we've changed people's expectations to be able to test themselves at home and have access to that information. I mean, before this, you wouldn't have bought from Walgreens or your local pharmacy a flu test kit to see if you had the flu. You'd go see your provider. And so I'm wondering how that might change things going forward, because that was never part of our pandemic flu plan either. Different scenario.
All right, thank you.
Yeah.
All right, next, environmental health proposal from Sarah.
Greg should be on. So, okay. So, I had hoped to have like a one-pager, but just to define the problem, we have one staff that provides environmental health support to our county ordinance on nuisances, on public health nuisances. They're generally environmentally health-related issues in your community that impact your neighbors. It wouldn't necessarily be something like confined to just inside the house. It usually has to be something that spreads to the general public or outside that person's property. In addition, we found out through the pandemic, we ran into particularly issues around education and outreach. One example would be Montrose. We had a conversation, I know, and you've had a lot, Commissioner Ketchmark, about their community well system and manganese. We actually have 3 communities in Wright County that are dealing with that issue. And the information we got from the Minnesota Department of Health was, if you want to do community outreach and work with those communities, you're welcome to. They're not leaving their offices. In fact, they're working from home until the fall. And so that we did not have the capacity or the staff, or I would say the training, to provide that resource for our local communities. It had been a plan to have a long-term discussion about what kind of environmental health capacity we might want going forward. And during that discussion, both the person who provided those supports for us, but also the people at Planning and Zoning left. So you're now left with me. And I have worked at various size health departments, but have not found it where the backup to a program is the director. So we definitely need to think about the capacity and structure of how we do environmental health in Wright County. Greg and I were reflecting on today too. We also had somebody file an appeal to one of the findings on their property that it was a health violation. And the way that the ordinance is written, the appeal process comes to me, but I signed the initial order. So to that individual, it did not seem like a very transparent or fair appeal process, and I don't disagree with them. It made me very uncomfortable. We had to hire a private attorney to represent me, and then the county was represented by counsel, and then this woman had to bring a representative, all during COVID. So that was, that's not, I mean, I would say that's not appropriate, right? We need to have some sort of infrastructure and level within there so that there's the expertise to sign off on those violations, and then if it's an appeal, it comes to me, and I should be a neutral party. And then, of course, they can appeal to you. That is the next step, although this person did not choose to do that. We also have an agreement, or had an agreement that expired this year with Planning and Zoning to share funds with them. But we are in the process of trying to figure out with Barry what actually we were paying for with those funds, because it was, the MOU was very sparse in terms of what the service was. And we are currently, I mean, it's expired now. If we're going to move forward with sharing those funds, that needs to be documented what we're providing those resources for.
Have you talked to Barry lately?
I know that before he hired his supervisor, I think his supervisor, Greg let me know his supervisor should be starting, I think.
So he did hire somebody for environmental?
I swear Greg said he was going to be on here. I don't know if that's him in the corner.
Greg,
Greg, are you on?
Mr. Chair.
Yeah, did he
Mr.
hire?
Chair, members of the board. Yeah, he hired a gentleman, Lee's here too. I know his first name's Ned. I interviewed him and I cannot for the life of me remember his last name. But Lee, maybe you know when he's starting.
Oh, there you go.
Yes, gentleman's name is Ned Pettit. Planned to start on the 23rd of this month, just to discuss with Barry earlier today. So
I haven't met with Barry since that person was on board. Our plan was to wait. In the meantime, we also have the ability, when we look at environmental health, to look at a range of programs. So not only what we have to do with our ordinance, but we also have the gaps, some of which I just identified really quickly. But we also can develop some fee-based programs. And that is totally up to the board on whether or not we would like to move that way. It can be a way to build capacity and expertise within the staff, and also, have some layers between me as the as the director and the CHS administrator and whoever would be making any findings. We would also require those individuals, in order to run those fee-based programs, they have to be registered sanitarians or licensed in some way, so we'll get some expertise that we don't have. Right now, it's all on-the-job training. Anna was a health promotion coordinator. Anna's position, her degree was in health education. It was not in environmental health. So it was all on-the-job training. We would need a specialized position for that. Those fee-based programs are either 3 that you can delegate from Minnesota Department of Health. That means they would be locally administered. They would be your food, pools, and lodging. That's one program, but you do, I'm sure, Commissioner Vetch, you're aware of food program, right? So they do your food inspections, lodging, and licensing for those facilities, as well as your pools. There's the non-public community water systems, which is water system and well testing for primarily schools, maybe clinics, hospitals, depends on how many facilities you're talking about, but they're not public buildings, so it's not and while they are public buildings, they're not open for the general public. A public water system would be like the City of Buffalo's water system. So those have a small delegate program. I don't even know how many facilities that would be in Wright County that would be part of the process of doing this assessment. And then the last is another well program that I can't quite remember what it's called, also very small. Right now, I do know that planning and zoning is continuing with the private well testing program that they do offer, and that should be sustainable and not an issue. Barry and I did cover that when we talked. So what I'm proposing is that we form a small group of folks that can work through this. Greg has expressed a willingness to participate. I would love a commissioner to sit on that. We have someone from the Minnesota Department of Health willing to help facilitate. Our planner, Joel Torkelson, also used to provide this programming when he was in public health in a different role when he was a health promotion coordinator, so he's familiar with actually doing the actual ordinance. And we actually have a community member who lives in the county who is a registered sanitarian and administers several of the state programs as a delegate for the city of Edina. So and he is willing to participate on this group.
Mr. Chair?
Yes, Commissioner Vetch.
And I've had people reach out to me on essentially the lodging and the restaurant side of it, more from a local control and to get more uniformity, because the state, the health code is very large and very ambiguous, and there's a lot of interpretation. So there was at one point there was a push from people that wanted it to be more locally controlled and having it being able to be administered more uniformly, instead of, because with the state at times they had so much turnover that you get an inspector one time and the next time it's a 180-degree interpretation because that person, there was just so much transient in the state staffing. But I have had more questions on the local control good, the uniformity good, but the cost to it, and making sure that by taking that on, that we're not impacting the restaurants or hotels and the daycares with a higher fee, as well as us being able to recoup our costs.
Well, we've got to find employees too.
Yeah.
Well,
But the difference is with a lot of the state ones, because the state budgets, a lot of them are contracted positions based on bienniums, so they tend to have higher turnovers based on two-year deals. That's just how it works. What I've seen a lot of those type things where they're administered with cities and counties, they tend to just have the way their budgeting is done. They don't work under those type of environment, so you tend to have a lot more continuity.
When I used to teach the certified pool operators course, I dealt a lot with St. Louis County, and I know they have a very good program up there for inspections for both restaurants and pools and all sorts of other things too, motels.
Yeah, I think I have access to all of those folks. I think one of the other complications, just for probably your constituents have let you know, is that there is also a portion of the food code that is managed by the Department of Agriculture.
Yes, I was gonna mention
It's a little
that.
bit more complicated because there's some statutory language that makes it sound like you can no longer be a delegate. There are different legal interpretations of that. But it is much easier for an operator, someone who's building, either starting a business or whatever, because locally, we don't care if it's the Department of Agriculture or Department of Health that we're a delegate of. You can send the same inspector. And if you have an operator that owns multiple facilities, they're working with the same inspector regardless of where their license is held, which is nice because you build a rapport. I had a similar type of relationship with the state when I worked in Wisconsin. And what was nice about that process was also if there was a concern, and you just heard from our phone system, you reach a live person and you get to talk to your inspector or you talk to your commissioner. I will say, sounds like a great idea. It's a little bit different. To be completely transparent, all of those environmental health inspectors had to follow whether they were county employees and delegates or state, had to follow the executive orders and all of those things. So there was still a lot of friction and a lot of frustration with operators, especially restaurants that had to be closed or whatever. And those portents, no one was in a good spot because the inspectors were also there enforcing it, and it was difficult.
Mr. Chair.
Yes, Commissioner Weber.
And those inspectors, it all depends on how they interpreted the law. Because there were always areas, I know that from having grade A dairy milk. And for instance, here's an example. One inspector came in and there was a deal that the door, the outside door on the milk house had to be closed within a certain amount of time. Well, one guy never said anything about it. Then the next inspector came and said, you don't have an opener, a closer on that door. And then the other guy came back because he was just gone for a while, and he said, well, I never thought about that because I don't know if your room was tilted enough or what, but it always closed by itself. So, but the other guy insisted that we had to put a door closer on there. So, he could have sat there and watched if the door closed too, but.
I think the dairy inspectors thankfully are federal, so we're not gonna be looking at that
okay,
one.
Okay.
So when you do
Well,
that,
I don't know. They always had the state
Well, if
emblem
they're Department
on
of
the door.
Agriculture, they hold on to their stuff tightly.
Mr. Chair.
Yeah.
So the question is so then when you're licensing, like right now, it's currently done, your license is through the state. So we'd be issuing your food license then locally at the county level. Typically what you get as a caterer, when you cater in different cities, you gotta go and get your Bloomington or your Minneapolis, your permit. And so then we get to retain those fees, or is it a split between the state?
Pretty sure it's a retention, but I think what I would like to propose is that we spend a short amount of time with the group kind of determining the scope and what we need to build. But if it's determined by this committee that we would go to this delegate status, that is probably a multi-year project.
Oh.
Because that would be when we go dollars and cents, how much are licensing fees, salaries, job descriptions, all of that.
But even peripherally, I'm trying to do an analysis in my head. Like I have to kind of get an idea of what those numbers look like now before I'd even be able to just scoping out whether it'd be something you're interested to get into. Because then you develop, okay, roughly this is what we could generate for revenue out there. This is roughly what we're going to need to do it. Is the juice worth the squeeze?
Right. Yeah. So I asked the state was even if delegation was an option, because they did remove, and they were very rural communities, but at least one had their delegation agreement canceled during the pandemic. I can certainly ask. I don't believe that there's any cost sharing because it did not come up in our conversation. It really is, what did come up was managing what you expect to be as your fee level in order to make it work. Because there is no state support either. It's not like we take on the contract and they say, oh, and we'll support you X number of ways.
Well,
Which
doesn't the state charge?
Oh, absolutely, they charge.
So they currently charge, so, and they're gonna continue to charge?
No.
So this can be,
So instead of paying the state for the license, they pay us.
oh, okay.
So Sarah, is your,
Mr. Chair, and Greg, you're gonna do the research on this because it's statutorily on how you charge the fees, because I think a lot of them are based on, like, if you're talking in the food licensing side, it's based on square footage or occupancy loads. And I don't know if that's part of the statutory or you can create your own metric for that. I don't know. If it's like a municipal liquor license, you kind of have a lot of your own latitude in terms of how you create your fee schedule, or is it very defined in state statute on how the fee structure has to be calculated?
And I think we can, so I was kind of hoping that we would get a commissioner to be part of the group.
Yeah.
You know,
Sure, that's what I was just gonna say, I mean, I don't know if.
so Sarah, is your ask at this point, you're letting the board know that you're gonna move forward with the group, and you're asking if anyone would like to be part of that group, and if they decide they are, would you want them to email you or make that decision today?
My ask is if you see the need to move forward with a group. And if so, who would you like to see represented on that, besides the ones that I mentioned?
My thought is, we're talking about adding a level of service that would, well, you would be a percentage of it, maybe half, I don't know. But we're talking also about Barry's office and crew, of which he is in the process, or gonna hire somebody soon. Before I would like to form any committee or any interest that way, is I'd like to iron out what we got going in planning and zoning. We got a new administrator there, we got a new environmental specialist that maybe's been here, started, maybe not, but we got some things we wanna work out with changes in that role that we've been waiting for a while since the last person left. As far as the compost facility, where is the person gonna office, how much are they gonna be involved in? I wanna make sure we can take care of the stuff that we got here now.
Mr. Chair, and I think that was the reason the discussion, because looking at it holistically in trying to determine what that role is and what they need to be able to facilitate that role, now is actually a good time because if you're going to create this, that person is going to be involved in that. And so you kind of want it from a ground up to create it that way. Because maybe we'll go through this exercise 2 or 3 meetings and we realize real quick that it ain't going to be worth it. But at least if maybe we do decide it's worth going into it, then when we're developing all this other stuff with the compost facility and managing these other areas of it, that planning and zoning and that environmental services, manager, I don't know what the exact title is, that would probably be a likely person that would be managing it. Potentially, or a conjunction of a public health piece to it, or maybe that whole aspect moves underneath public health. But those are things.
No, I would think because she's the one that has to, or the people can sign off, or people can come back and say, I don't agree, and you would have.
That's an ordinance, I guess you'd have to open an ordinance.
Yeah.
I think it's worth exploring it into a smaller group. I'm happy to be part of it. The only thing is that I'm done the end of this year. So do you want
has
to?
to finish.
3-year deal probably.
The thing is, you want continuation from, somebody that's going to be around next year to continue with it. That's.
Well,
Mr. Chair.
Mr. Chair, it seems like if that small group meets and, kind of figures out the parameters, we're missing the health promotion coordinator. So that's, they would go around and inspect these properties and essentially, make these determinations. Well, maybe they can work in conjunction with the environmental specialist. I don't know, but I think that definitely it's worth sitting down with the committee, with legal and environmental and the commissioner and Sarah and trying to figure out just what this means.
Commissioner Wetter?
Yeah, when you're talking about this, I know, Derek was mainly talking about restaurants and supplies. Now, would that also deal with like maybe a cannery or something like that, or some kind of production? I wonder, you just talked about a few departments, And I was thinking of the Department of Labor and Industry. They might be involved with some of that besides the agricultural area. And, because I know they've got inspectors that look at compressors, boilers,
But normally-
that sort of thing, you
But
know.
normally they've contracted that out. Because I have, they have to come and inspect mine.
Yeah.
And it's a private company that does. In fact, I think it's my insurance company that does the actual contracts and have it done.
Well, for our boilers and that, it's been actually the state comes out.
Yeah,
You know, honest, it's the state and then
You're
it's.
high pressure though, I'm low pressure.
So, true, but I'm just saying that they do like the compressors and all, all that sort of stuff, and I mean, how far do you go into it? That's what I guess
There's
that
defined
committee would probably be able to figure
Yeah,
that out.
I think it would be up to the committee to define the parameters, and I agree with Commissioner Vetch, it probably would be pretty quick to determine where that is. And then longer term, it's gonna take, depending on what that scope is, it'll take time to enact it and what order. And I don't disagree that planning and zoning and the fact that we don't have someone doing our work right now except me would be the two priority areas. The next priority isn't to go, oh, let's start taking over this contract, right? Because we definitely have to. But there is still not an agreement between what planning and zoning was doing. And it's not for lack of trying. Barry and I have met and had a great first meeting, but it was sort of like, well, we both have to go back to our records and try to figure it out because it's old. The contract was probably at least 8 or 9 years old.
So the consensus is to generate interest and start the group, and Commissioner Dahlheiden is interested in being on that if you can use them.
Be happy to use them. That'd be great.
Thank you, commissioners. Is that what you
And if
needed,
you
Sarah?
want
Yeah, and if there's any other folks,
I was gonna say, and if you want somebody continuous, I would.
Okay.
okay.
I'd rather have somebody that would be, I don't know, you want both of us or just one?
It's to the will of the board.
Might be
I'm
good,
fine
just,
with whatever both of you want.
yeah, I think,
If you
good,
want
start
to
with two.
too, I.
Commissioner
Okay.
Dahlheiden and Commissioner Wetter are interested.
Great, thank you.
Yeah, I'll make that motion.
All right, motion made.
I'll second it.
Further discussion? Not all those in favor, say aye.
Aye.
Opposed? Motion carries. Thank you.
I'm sorry, can I make one last request, Chair?
You only had 10 minutes.
I didn't realize it
Used
was
up
take that long.
every one of them.
I would
Good.
I would
Oh, yeah, she
recommend that
does
we
only have
have an operator on the group, if we decide to go that way, or someone who holds licenses with, either, with probably MDH. So, if there's someone in that restaurant or lodging community that would be interested that you know of, I'd be happy to invite them to discuss.
Derek, you know anybody?
Yeah, I know a lot of them.
I mean, it has to be something they are interested in.
Yeah.
Yeah.
I don't want to take their time if they're not interested in.
Do you think there's anybody that you know of that would maybe? be
I would
interested?
say you'd probably want two, and then you'd want it from, because that area encompasses a wide variety of people and wide users. I'd probably take one from either a light food manufacturing side or from a restaurant side, as well as, or from a childcare or a school setting or something, because a lot of those school settings all fall underneath it as well.
They do, yeah.
Oh, that's
Okay.
right.
So
You're
there's a
right.
variety. You'd want to have at least two that kind of are in different polar sectors of it.
Well, start thinking of those people. I don't want to invite them until well, I don't know. Do we want to invite them to help determine the scope? They might have some opinions, or would you want to invite them after we've determined the scope?
I would think it'd be kind of nice to have them
From the get-go?
from the get-go, because then they can say, there's no way in hell we want the county involved.
I mean, it's an opinion that's valid, absolutely.
Yeah.
Yeah.
Or we would prefer that the county, because it's easier to get a hold of the commissioner to wring his neck.
All right. Thank you, guys.
All right.
Thank you.
You got enough to work with, Sarah, on that?
I do.
Okay. Next, information,
hospitals and
HHS
stuff.
Advisory Committee meeting minutes
Get
from
into all
Jill.
kinds of stuff.
I will just go through these pretty briefly. We met as a committee on January 26th. We did typical welcome and introductions. We had an update from the mental health advisory group. One of their highlights was the Buffalo Strong Day on February 9th, and we actually had staff and tables there at this event, and my understanding it was
Yes, we
quite
did.
successful, and there was a great community turnout, so that turned out to be very successful. We're very happy to be able to
Very
report
good.
that. Then we had a public health task force update. And then they both basically gave a quick rundown of things going on at the dental center. We did an ARPA update. Basically, Commissioner Hewsome just gave an update of where the money had been going and where process was. Do you have anything else you want to add from there? The bulk of the meeting was spent, Joel Torkelson, Emily Anderson, and Jody Martin came, and they are a group that we've kind of tasked to be working on our Clear Impact scorecard, and Jamie has talked about that, I think, a few different times in the past. That's the software that we're using to showcase our programs and our service outcomes. So we're hoping that this is going to be a scorecard, and it's the same information that Christine Partlow utilizes when she shows you her graphs and the up and down trajectories. And we're going to utilize it for our program outcomes. So anyways, we're in the process of working on that, and we're going to be bringing it back to this group when it's more finalized. But during the meeting with HSAC, we got their information and their feedback and their input. Since it would be a county information to the community, we wanted community member input. So they gave us some good ideas and suggestions, and we took that back, and we're going to finalize a more finished product and then bring it back to the board to show you that. Otherwise, we did just a basic budget update and went over legislative priorities.
I had a question, Jill, about
Sure.
the attendance part. Jamie Goodrum, you got an X by her name as she's present, but then excused next to it.
But I think she was there.
I think, yeah, I looked at that too, and I think she came later.
I was gonna say she was present, wasn't
She
she?
was-
Amy,
Yeah.
She came later, right?
I have to remove the excused part of it, I guess.
Oh,
Amy.
I wasn't there.
She was
so
present.
yeah, good question, but.
She was present.
Yeah, she has, I think
came in
initially
late.
she had something going on, so she couldn't join us till later. if I
Yeah, she was
remember
at
right,
MEC,
but It's hard for me to keep mentally track of all the committees I'm on.
Thank you, Jill. Administration, director's comments.
I just have a few items. The first one we wanted to share with you is that unfortunately we are postponing our all-staff training day, which had been scheduled for March 1st. We are postponing because we do not have technology in the new room just yet to be able to support our speakers' PowerPoints and different things that they wanted to be able to show and display. In addition, we're hoping that we're going to be moving and getting things prepared that week, so we didn't want to add and try to go have a full all-day retreat fun day in the middle of a bunch of stress and things going on. So we will be rescheduling for another day into the future. So my question for you is, would you like us to come back and let you know that date, or just continue on and move forward?
I'd like to know the date. You
Yeah,
can
we
let
can
us know.
Yeah,
Okay.
And I'm assuming, or coordinate everything you'll have.
because it was
a month or
approved.
something. So it'd just be nice, it would be nice to know.
Absolutely, because our plan is to still to have everyone be in attendance and be able to do something as full HHS.
And that's out at the new building, right?
It was approved last meeting, right?
Yep.
Yeah, so.
Yep. So just wanted to let you know that unfortunately the date is just not going to work out. Another update, wanted to let you know that the housing development project that had been previously discussed here at a board meeting, it was brought forward from Duffy Development Company, had made application to the Minnesota Housing Finance Agency to develop an apartment building in Monticello. It was going to be called Monticello Workforce Apartments. And it would have provided a little bit more affordable housing in that area. Unfortunately, the MHFA did deny their application. So they are going to work together with them and hopefully get a stronger application out there for the next year. So they're going to try again. But that was a disappointment for us because we were hoping to have another option for housing in our area. On a positive side, another highlight, we have a new residential facility opening in Otsego. North Star Regional Otsego campus is taking referrals and is actually opening today. And this is a men's residential and intensive outpatient with lodging facility for co-occurring mental health and chemical dependency disorders. So that's actually really, really wonderful. We have had a shortage of mental health and chemical dependency residential level services for some time. So this will really give some more opportunity for folks to get the support that they need. And it's a decent sized community or facility. It's going to be 62 residential beds and 83 IOP beds. So
Yeah, and it's nice that that facility's gonna get used too, because
Yes.
it's been
forever.
some issues going on there for the last couple of
Right.
years,
So we're very excited that that's getting off the ground and getting going. So that's something that our community will benefit from. And the last thing we were just going to highlight, I think in your packet you had some birth record data. It's mostly self-explanatory, but Sarah, do you want to answer any questions that anybody may have? Or are there any questions about the birth record data?
I think I've used up my time, but.
How about we'll just go with, are there any questions or would you like any highlights?
I don't know if I saw that. Maybe it was that one you had to click onto and I didn't see
It
it?
looked like
I don't
this.
know, Amy, I didn't see it linked in the agenda.
No, I don't think it was linked in the agenda. I've seen that somewhere though.
I included it in the commissioner's invite.
Packet.
Yeah, okay, I missed
Should be
it.
That's
in the
what it was,
packet.
yeah. Yeah, when they were, yep.
I went the other way and so I didn't see it.
Okay.
Sorry.
Any questions or information, let Sarah know. Does that work?
Okay.
I got a question unrelated to the report, but
Sure.
I saw tomorrow on the agenda, there was a whole plethora of folks requested for replacements. I was wondering if I could get a count from 2021 on how many people left HHS and the percentage of turnover that amounts to. Just to kind of get the perspective.
Sure. So 2021?
Right. Just to keep a round calendar year.
Yep. You can get that, I can let Jamie and Amy work on that for next time.
Thank you. Any other business?
Mr. Chair,
Yes, Commissioner.
I wanted to thank what Health and Human Services did at the Buffalo Strong deal. That was really nice. And what was really nice was the bags you handed out, because it said Wright County, on it, and it was very obvious, and the only ones that had bags for all the stuff that she could gather at that.
Well, it's kind of a funny
wellness.
story. I was going to give Michelle Miller some credit. She was running around at the last minute saying, what kind of fun stuff do we have? And throwing things together, so.
I gotta buy, I got Kleenexes.
There you go.
I liked all the stress balls and stuff.
Well, if you guys are putting out things that say Wright County, that needs to get changed. It needs to be the Wright County.
Dull right now.
Oh.
You need to work with the branding.
See, gotcha.
But I thought it was.
Said earlier, forget it.
I thought you just represented the county very well, those
Thank
that
you.
were there.
Yeah, thanks for everything.
I can bring that back to our staff that were there.
Yeah, it was a very good night.
All right.
That's all I
Anything else?
have.
Thank you. We'll adjourn at 2:47. Thank you.
Thank you.
Thank you.